Thank you so much for being here today. I would like to start today by acknowledging that we're on the traditional territory of the Anishinaabe, the Haudenosaunee, and the Wendat peoples, and that Toronto is home to many Métis, First Nations, and Inuit peoples and communities. As an immigrant to this land, I'm grateful for the opportunity to live, to learn, and work here. And I commit to listening, to learning, and contributing to a more just and respectable future. I'm so pleased to welcome you all today to this event. This is a Better Together gathering where collaboration, innovation, and shared purpose drive our work in early childhood education. For those that are new to Better Together, this is a collective of service system managers from across Ontario, united by a commitment to reimagine early childhood education. Through new models, for fresh narratives, and strong alliances, this group aims to push the boundaries of what's possible and create meaningful change for children and families. We invite you to engage, share, and be inspired. If you have any questions or want to learn more, please don't hesitate to reach out to me or the visionary behind Better Together, Michelle Schurter. So let's get started. We are honored to have four incredible guests who will share their insights, experiences, and models for providing special needs resources in their regions. Each speaker will introduce their approach, highlight key challenges, and discuss opportunities for improving support for children and families. We will then open the floor for questions, allowing for a rich discussion and exchange of ideas. We encourage you to engage, ask questions, and reflect on how we can collectively strengthen inclusive practices. So without further ado, I would like to introduce our speakers today: Jennifer Butera, Manager of Children's Services, Community Strategy and Partnerships with the Niagara Region Community Services; Shannon Costello, Director of Children's Services, Cochrane District Services Board; Christine Charret, Children's Services Supervisor with the District of Temiskaming; and Shannon Brown, Manager of Children's Services Department, United Counties of Leeds and Grenville, who is having a little bit of audio tech issues, so I hope it will be solved before she speaks. I would like to open the floor and invite Jennifer to begin.
Hi, good morning, everyone. Thanks for having me today. I have a quick slide deck. It's only about 5 slides, so I know most of the content will be surrounded around our discussions, but I'm going to go ahead and share my slide. And it's very difficult sometimes because you can't always see what you're looking at. Okay. I'm just going to ask for a thumbs up that you can see my slide deck and not my dog or something.
Yes, yes.
Okay. Okay, great. So here in Niagara region, I'm just going to give a bit of an overview around our current, very quick overview of our current structure, how our model is currently structured, and then talk a little bit about, we are in the process of a third party review of our current model, and I don't have the outcomes of that to present today, but I'll just speak a little bit about what our current model is structured like. So in Niagara, we contract 7 different community agencies to provide resource consultant support to our CWELT contracted childcare, licensed home childcare, and early on centers. We also have the opportunity here to contract one of our community agencies to provide 2 behavior consultants to our early years and childcare sector. We do have a Pathstone Mental Health, which is specifically a mental health agency for children and adolescents. So we are able to have that partnership with them, which is great. Sorry. So our referral process looks like this. So our centers complete screens for each of the children in their care. So within 6 weeks of a child being within care in childcare. They are asked to screen using a DPS, which is a developmental preschool screening tool, speech and language pathology or speech and language tool assessment. And then we also have the option of something that's sort of Niagara made, which is our care behavior assessment, which screens for challenging behavior. So if there are any concerns that come out following these screens, the referrals are sent then to the appropriate agency. So this just allows for some guidance across childcare around what to do if there's any flags that come up. The agency then sends us the client information, and if the RC or the BC is needed, and then the RC or BC will help facilitate referrals to community agencies when required. We do periodically meet with our resource consultants when there are complex cases, such as something new that we have implemented is a potential termination form. So we're asking our child care centers, if you find that you are kind of on this pathway of potentially needing to end somebody's placement, we ask that you connect with us first, and we'll pull together a community meeting to sort of figure out like what's going on, what have we missed, what do we need to do, who can we bring in from our community to help provide some better supports. The type of data collection we take are the number of assessments that are completed. So across Niagara, how many assessments are we completing? As a result of those assessments, how many referrals are being made so we can get a bit of an idea of what are the current needs in Niagara, what are the children on the caseloads for our resource consultants and behavior consultants, keeping in mind that across Niagara, we have two behavior consultants that currently support our childcare and early on sectors. And of course, the numbers are growing and growing. What are the age ranges of the children? Which centers are we supporting? And of course, so how long are children staying on caseloads? So, some of the current challenges which have led us to doing this review of our current program is that we do have a lot of agencies and we just want to understand where are the inconsistencies. So, are there things, everything shifts over time, policies, procedures kind of shift over time, and kind of who's doing what, just get a lay of the land, who is doing what, where are some differences potentially that are happening. We know we've had a lot of increases to spaces with CWELC and the increase in spaces. That has been a bit of a challenge because we haven't seen a similar increase in special needs resourcing funding. So kind of working through how do you do more with less, essentially. So making sure that we're not, that we're able to keep up with the pace. We do hear from childcare centers that they're struggling, that anecdotally, they are seeing more and more children with unique or special needs entering into their centers. Um, we feel like we've seen an increase in terminations. Don't have quite the level of data that we need from previous years, but we're really tracking it now to see what are the number of terminations that are happening. And they're not big, big numbers, but one termination is one too many, really. So, how do we get a sense and a pulse on what's happening there and ensure that we're connecting with all the right agencies to essentially have zero terminations? And sorry, I say terminations related to sort of challenging behavior in these complex cases, not other terminations that are happening, which are like interesting because complex parent situations. But anyways, that's a whole different conversation. Also, centers just want more time with their resource consultants and their behavior consultants. They love the strategies that they're receiving from them, but they need more time to observe the resource consultants and the behavior consultants modeling these strategies. Like, how do we, put these strategies into practice every day? And how do we build our confidence in being able to apply these strategies? Educators working in childcare centers, this is not necessarily their skill set. And if you don't practice it every day, it's not a skill that you're going to be able to sort of naturally carry into your work. So how do we make this common practice? Um, and so we did review on this third-party review of our S&R program, and this we're hoping that will be shared in the next month or so. We know that our program's been this way for the past 20, 30 years, or however many years it's been in existence. And so it's just a really good opportunity with all the changes that are happening anyways across the system to really look at, is our current model the most effective and efficient way to support Niagara's children? So that's our SNR model as it is today. But I also just wanted to speak quickly about something very awesome that has been happening in Niagara with our early on centers. So we've been having this, we implemented a pilot project about a year ago now with our local Children's Treatment Center, who is also a resource consultant agency, so Niagara Children's Center. So in September 2023, we had this opportunity to kind of change how we would provide our SNR supports in early ons. And what we did was essentially have the Niagara Children's Center um, be the only provider of resource consultant support in our early on centers. So to really give the early ons a dedicated agency to provide that service. We see early ons as a really, really, really important part of our early years in childcare sector. So we have lots of children waiting for childcare. We're really trying to get families to go into the early on centers. We really want to promote early identification and early access to programs and the right kinds of supports for families and children, and to help support that transition to school. So in partnership with our local Children's Treatment Center, we were able to dedicate four that has grown by a little bit since the pilot to our early on centers. And by doing that, they've been able to create these really strong relationships with the staff in the early on centers. And so just some quick numbers. So previous to the pilot, we had about 26 referrals for resource consultant support from early ons. And within the first year of the pilot, we have 327 referrals. So, I mean, to me, like to us, those are huge numbers. That's 327 children that have now been connected to the right supports to help them with that transition to school. And so we just really think the success is just based on those relationships and really the RCs being able to be a part of those early on centers and be there all the time and really being that familiar face. They're present there, the families can connect with them, they're providing education to the early on staff, and we look forward to kind of seeing, we're carrying this through to the end of this year, and then we're really looking forward to seeing the numbers. So I'll end my part there because I know we're stretched for time, and I'll pass it back to Emis. Thank you.
Thank you so much, Jennifer. I'd like to introduce now Lynn LaBelle from Temiskaming. Um, Jennifer, if you can just stop sharing on your end. If I can do that. Ah, there we go. I did it. Okay, so I'll pass the floor off to Lynn LaBelle from Temiskaming.
So, hello, bonjour, everyone. So, my name is Lynn LaBelle, and I'm the Children's Services Manager with the Temiskaming DSAB. So, in Temiskaming, the Special Needs Resource Program was contracted out to a third party. We were seeing signs that the model was not meeting children's need in our district. So, a considerable number of children with special needs were being discharged from childcare due to lack of support for educators. So this was very concerning to us and resulted in a deeper dive with the current SNR model. We collaborated with an independent consultant to examine service delivery of the SNR program. The review was based on the fact that the Ministry of Education was actively engaging with the early years and childcare sector in the development of the new Canada-wide early learning and childcare funding approaches with the goal of improving clarity and transparency. So as part of the review, other system service managers were consulted about their S&R service delivery and their successes in supporting the inclusion of children in licensed childcare. So as per the consultant's recommendation, we brought special needs resourcing delivery in-house on January 1st, 2025. So it's very new. So our S&R team is made up of 4 individuals, and their title is Inclusion Support Workers, and they will work very closely with our Quality Assurance Coordinator. So with this being said, I'll pass it on to Christine Charette, and she will elaborate on our progress so far.
Thank you, Lynn. Hi, everyone. My name is Christine Charette. I'm the Children's Services Supervisor in Temiskaming District for the DSAB. So as Lynn mentioned, we did have independent consultants come in. They really assisted us in researching and collaborating with other DSABs and also other third-party S&R programs. And this really helped us tremendously in our planning for our new journey to directly operate the S&R program in Temiskaming. Leeds and Grenville was really impactful, as well as Cochrane DSAB, and it really helped us with our planning. So many thanks to them. Seeing as Cochrane district is our neighbor, and they really have an understanding and similarities to us with rural, Indigenous communities, the barriers that come with that, and they have been directly operating for a while now. So really, it was really nice to be able to meet with them, talk about their lessons learned, their challenges, successes, and their openness to a continuous collaboration has really helped us along the way. One lesson learned already is how valuable it is to collaborate like that. So since Cochrane has been so open and sharing their journey, it really helped us shape what we're doing here. So as Lynn said, it's very new. We literally just hired our last staff last week. So we do have 4 inclusion support workers now, 2 that'll be servicing the north of our district, 2 in the south. But we do have our quality assurance coordinator that will be working together with the inclusion support team. So that might be a little bit unique. And we're really developing how that works together. Since inclusion and quality is so intrinsically linked. And our coordinator also facilitates a lot of professional learning and communities of practice and other capacity building projects. So working collaboratively with the inclusion support team will really be like the boots on the ground to continue that transfer of practice when we do offer some PL to our educators. So we were finding that our quality, through quality, that there was a trend that I'm sure some of you may have seen across the province, where there was a combination of mitigating factors. So staff shortages up here in the north, or not being able to find francophone staff, hiring unqualified staff. You throw in COVID in there. Our quality assurance coordinator was kind of getting pulled everywhere to see if she can just support a classroom specifically for challenging behavior. So losing sight of all that other beautiful stuff that comes with quality assurance. And she was really having to tackle fires, so challenging behaviors, self-regulation issues in the program, which again affects quality. So by having the inclusion support team respond to this in a more direct and targeted way has been really helpful already. We're already seeing some impacts there. There's also opportunity to direct her professional learning. So with direct feedback from the team, she can respond to the needs more efficiently in a more relevant way. Our vision is that the transfer of practices of the strategies learned will be enhanced by having the inclusion support staff. So they will be there to create intentional goals, practice the strategies, model, address barriers in real time when working with children. Some challenges we found already, because we're still in a transition phase, there's been a bit of a challenge with meeting children that were already being served by our third-party model, and that may have been served in a different way. So really trying to bridge that gap and allowing the educators to understand what our scope of practice is, how we will support them, and that their provider is really like our client in a way, that we will be able to support the center and the educators, give them more time. I think as the previous speaker mentioned, the educators needed more time to implement a lot of these strategies and somebody there to model that with them and then give them time to practice it. So maybe while they're practicing, the inclusion support can kind of help with that day-to-day just to make sure that these things get implemented properly. So again, another challenge is the demand or requests for one-on-one. So we will have some enhanced support funding available, but again, this will come after inclusion support workers come in and work with the teams, work with the educators, put in some training, put in some goals, and that will basically be if there really is still a safety risk or deem that they need a one-on-one, there will be some, based on availability of funding, they'll be able to be hired by the provider. And the role of the additional staff would be more to be the additional staff so that the main educators in the room can focus on practicing those strategies, meeting the needs of the child with special needs, and the inclusion support team will be involved with this ongoing evaluation of the needs and any barriers that educators are facing. So again, with that, there's a challenge because if there's we have difficulties in hiring staff in general. So hiring an enhanced staff for a short period of time, I can foresee will be a challenge as well. So definitely a lot of challenges there, but that is something we're going to try and offer as a last resort. We also have a lot of turnover of like supervisors, so we're going to do some leadership modeling as well. Another challenge is the evaluation. So again, I'd love to hear, I'm glad we're here today to hear how others are doing this. I already have some ideas from the last speaker, because obviously we have our quantitative data, but we do want to collect some qualitative data that'll be meaningful, as I'm already kind of getting from our staff in the centers that have already started their journey. So I'd love to hear what everyone's doing. So one challenge we found were children being turned away at registration. So we do offer that if there's an inability to support a child upon registration, the inclusion support team can be involved to do pre-registration meetings with children and the agencies if there are some involved, and help put those things in place beforehand. So whether that's training, adaptations to the room or resources. And then in the next phase, we'll be rolling out new referrals, and that'll be done by the childcare staff. So the supervisors will be doing the referrals to our inclusion support. If the center staff want to do a referral, as long as the supervisor is aware, that's how we will be doing our referral process. And eventually implementing some early intervention projects with early on as well. So I'm glad to hear that that's what others are doing. So one last thing, out of our third-party review, we got recommendation to operate a resource lending library. So to address the barriers where educators either they had lack of resources or access to training around how to use the resources. So through the inclusion support workers' recommendations, they'll be able to put in goals and plans around the resources that they borrow. Again, most items will be borrowed, but some items like personal items will just be given to the child, and will help implement the resource within the program successfully. And that way, when those items are done, we can make sure that they're used in a different center and to ensure every child is included. So thank you for that. I look forward to hearing the others.
Thank you so much, Lynn LaBelle and Christine Charret from Temiskaming. I'd like to now ask Shannon Costello from Cochrane if can open your mic, and I'm just gonna pin you here. Okay.
Good good morning, everyone. Sorry, I keep thinking it's the afternoon today.
We're almost there.
Okay. I did create slides as I'm going to try and stay on task. I tend to squirrel for sure. So I'm Shannon Costello. I'm the Director of Children's Services for the Cochrane DSAB. I would like to show a little bit of what our district looks like and give a little bit of a background. So this red area is the Cochrane DSAB area. We service from Moosonee to Hearst to Matheson to Timmins area. So we have quite the geographical area where we serve. We currently have 2,444 licensed spaces in the district. 87% of them run by not-for-profits, and they're only at 50% utilization right now. The majority of our centers that are underutilized are our Francophone sites, as we cannot find educators that are Francophone. Majority of them, of the non-qualified educators are in the Francophone centers. The one organization that we have that runs 12 centers in our district only has 2 RECEs out of like 60 or 70 right now. So it is a huge issue, which also brings other issues with special needs resourcing. We've had to change our approach quite a bit. So we do have 63% of our 260 educators are unqualified in our district, in both Anglophone and Francophone centers. So our journey for our special needs resource model started in 2018, late 2017. The Cochrane DSAB at that time was paying around 28% of their budget for SNR. And we knew that the new funding formula at that point was being talked about changing over in 2019. And we knew that changes were coming. I started with the DSAB in 2018. I used to be the general manager of the YMCA of Timmins here in our district. And we looked at the current model, which was being run by a third party. That model was focused solely on individual children with high needs that were being brought into care with a one-on-one worker on a bus to those centers. And then they left before noon. They had barely any inclusion with the other children in the room because they were
Heather.
OT and therapy, all that speech therapy and everything while they were in the center at those times. And we were also, the DSAB was paying for individual resource workers at every center based off of request, and then remained on contract. We found after some discovery that we had educators that were being paid for with children that had been out of the service for 7 years. So we knew we had to do something. The pilot project started with the third party that was working with the Cochrane DSAB at that time. However, when COVID happened, that third party ran into a lot of challenges. It was really hard to manage that they were actually still supporting children while they were working from home. And at that point, we knew we were close to deciding on direct delivery, but we made that decision in 2020 to move the program to a full program quality consultant program in the Cochrane area, directly operated by the DSAB. What was the purpose for our quality consultant program? Provide professional development, because we knew a lot of the issues from the pilot. It wasn't the children that needed a one-on-one. It was our educators needing to create the environment to make it more inclusive. So that was, we could definitely see that need because of the high number of non-qualifieds. Even the basics of childcare were something that consultants were even having discussions on. And went with the third party, and because of our geographical area, it was very hard for them to get to centers. They had a very small amount of staff and only one Francophone educator in our district, and we are an FS, like a French service language district. So that was not conducive as well. So we had to ensure that we had some Francophone consultants to assist with that. Looking at strength-based views on children and, how we could set up those environments to be inclusive, culturally relevant, as we do have a high number of Indigenous people that live in our district. And being able to monitor and evaluate strategies if there was a need for one-on-one. So the funding is no longer, it's like in a 3-month contract. Have they been performing strategies, et cetera, et cetera. So the program, the consultants have a supervisor and then 4 consultants that we have 2 that are based out of Kapuskasing, and then the rest are out of Timmins. We do a lot of driving in our district. Moosonee does receive services from us via, majority of the time, via FaceTime or Zoom, where we do a lot of the consults. We do try to get up there a couple times a year. We've been good for bringing specific professional development when we go, and other agencies with us when we get to go. That actually happened. We did an autism training in January when Kathy went up to Moosonee. And really looking at that physical environment and switching to a universal mode instead of a one-on-one mindset. We use the tiered model approach for when there is a request for funding for one-on-one support. Our consultants are there to help educators with those ISPs. And we discovered a lot through the pilot project that ISPs were not being written, period. So that was one of our first tackle challenges, is teaching center supervisors who were very green. We have a lot of director approval supervisors in our area that needed that guidance to even how to write an ISP. So that's been a big job of the consultants, setting up those ISPs for children that need it before they even start childcare, making referrals, attending case conferences and school meetings. They're doing a lot. So this is just a quick little overview of the tiered model approach. Majority of the children in our district are in tier 1, that the services needed for that child in that room and the environment will benefit everyone, with another portion of our children in the tier 2. We have very few in tier 3, 1 or 2 maybe, since this model. We've had lots of challenges since 2020 doing this. One of the biggest challenges has been the universal versus the one-on-one mindset, trying to get centers to agree upon that. We've had a lot of success. Oops, sorry. Shoot. We've had a lot of success with that with our for-profit centers, as well as our smaller centers that don't have a home office or an agency or a brand, they've been really positive about the change and really looking forward to when the consultants come in, or our professional or our program quality assessment team, building those relationships, being not only on the educator end, but our consultants, really teaching them how to be a coach and not a boss. Like, you're not licensing. You have to go in and coach. It's not, and it's a different technique to how to be a coach and get over those frustrations when you create strategies and then you go in to visit again and they're not being met and there's not really much you can do. So like, how do you change your approach as a coach to really get those educators to take some, take see the real purpose of why those strategies are being implemented and not implemented, but asked upon to be implemented. So we've had to change a little bit of our mindset and the way we do things and create some work plans with our consultants as well. And that educator to trust the advice being brought. We had to really get across the stereotype. There are some supervisors with the whole CWELC going on that didn't trust the opinion of the DSAB because of all the changes that were happening with funding. Even through COVID, all the changes with all the guidelines that were changing constantly. We kept trying to tell people we're learning the same time as you. We barely get any advice prior to it being announced publicly. So that was really hard to manage around this. But I find since CWELC has calmed down, we are definitely building stronger relationships. That resistance, changing the mindset of educators and operators, that you're an educator, not a babysitter. I find a lot of the non-qualifieds didn't really understand or have a good orientation as to what a childcare educator does. So they were not taking those opportunities to teach children in our district. Planning decreases behaviors mentality. So saying you don't have time to plan will like involve the children if you do plan, you'll have less behaviors, trying to keep up with those changes. Strategies are not extra work. It actually prevents behaviors and allows you to do more with the children in a more positive environment. Our geography is definitely a challenge of ensuring that we can reach everybody in a quick time, especially when they're in a crisis. Lack of supply staff, just a lack of staffing, to be honest with you, across our district doesn't allow much time for consultation or conversation. So, and a lot of the women that are working, a lot of the educators in our system are women, and they all have children. So it's hard for them to ask them to stay later and longer hours to have those consultations. So, really had to change the model of making sure those consultants were staying in there and really role modeling what the coaching that they're supposed to be doing alongside them, and motivating educators about their purpose has definitely been one of the biggest challenges here in the Cochrane DSAB. A lot of the positives, the ones that educators that are open-minded feel definitely some more value and sense of purpose with their work. They're reaching out to look for help. Their ability to offer a variety of professional development in both a large scale across our district and in personal, where our quality staff and our consultants are being asked to attend staff meetings, really building those relationships, and some development of new tools to increase the toolbox of our educators across the North. So I just figured I'd show you a little bit of a snapshot of last year. So in 2024, our team received 136 service requests. So this is beyond the regular visits that the consultants do just to pop in. And sometimes those they are able to do some quick solutions with educators at those times. But so this is 136 service requests. These requests encompass coaching, observations, parent meetings, resource support, assistance with the digital support plans, and training requirements. So our consultants traveled 21,949 kilometers on unpredictable roads, like today, where we got 40 centimeters here in the north, for 586 visits to childcare centers. They also dedicated about 101.4 hours on indirect services through emails and calls and video consultations. And in 2024, we had 167 children with special needs enrolled in our district childcare centers. There would probably be a lot more if we could find additional staff to open our centers up to full capacity. Some of the professional development that came out of our consultations, we really concentrated on bringing learning outdoors in this last year, and really looking at creating different loose part opportunities that were inclusive to all children. Every activity has its how you can accommodate children in different ways and different styles of learning. We did an Engage and Explore Create professional activity day that was focused on play schemas and loose parts. Educators received some diverse materials for creating inclusive play invitations. And it was funny, I like one of the quotes, it was very educational and explained so much of our behaviors. So they were getting it and being able to participate, lots of hands-on. I think that's one of the things that we've really learned, that our educators were expressing, that they needed more hands-on learning. We really could see the burnout across the North, especially with our veterans that have been around for a while. So we did some clarity with one of our counseling organizations here. It's some virtual workshops on burnout. We did a lot of focus on supervisors and educators, so that supervisors not only can recognize their own self burnout, but recognize when their staff are burning out. This was one things that our consultants did, where they could see the environment was not conducive to inclusion. They needed some extra supplies or resources in the room. So using a little bit of our play-based funding, we had a consultant work with 4 different classrooms where they really looked at their environment and what they needed to adapt in their space. as well as include and, some of these rooms didn't have any sensory tables, didn't have any sensory activities, didn't really look at the purpose of learning, and nothing was age appropriate. So they were each given a couple weeks to go through the room and really plan, and then present a budget of $2,500 to buy equipment for their space. And then they went through how to introduce the equipment into the room, and how to ensure that all children are able to enjoy the equipment and participate. So one of the comments there is the children that have ASD are interacting more with the whole group as opposed to solitary play, from some of the results. So it was really a hands-on learning and really digging deep into the environment, to also to use funding for play-based equipment in a purposeful way for the environment. We also
Shannon, just giving you a time, one more minute if
Hey.
possible. Thank you.
Super close. We did some on nature, professional development, and started a community of practice, which has been well attended on a monthly basis with our supervisors to give them some leadership skills, as well as some cultural sensitivity, as we had a lot of, when you look at inclusion, we have a huge population of South Asians that have moved into our district, that we used to be a very white community, and we really noticed that staff needed that training as well, so looked at that as well. Early on, we also did some monthly professional learning as well on all the same similar areas of need. We did a bunch of new initiatives as well that have been positives from our consultant program. We've created learning modules that are being very well used with all of our centers to help with that non-qualified become more educated. 97.6% of them have stated that the modules have been good to put back into practice, as well as our analysis for developmental planning and inclusion tool. This tool has helped educators plan what needs are in their classroom to help with developmental milestones. And really looking at reflective practice for educators. We also did an ISP review summary to really go over where we need further help, and this is the task for 2025. So,
thank you.
I could go on forever.
Thank you so much. I know that in my conversations with Lynn, that Cochrane was a big support in the transition of Temiskaming's model. Very interesting. Thank you so much. And hoping that Shannon Brown from Leeds and Grenville's audio is working. Do you want to test that out?
Hi everyone. My name is Shannon Brown and I'm the Children's Services Manager for the United Counties of Leeds and Grenville. We're located just south of Ottawa in a very large geographically placed but rural community. I wanted to give you a little bit of background on our special needs resource services, where we came from, where we are now, and where we're going next. Leeds and Grenville had historically contracted with a third-party provider, developmental services agency, for about 20 years to deliver our special needs resource services. About 8 years ago, we were getting a lot of feedback from operators who were complaining that they weren't feeling supported, that children with special needs were becoming too overwhelming, that there needed to be more money and investment in special needs resource. And quite frankly, we're complaining about the things that we thought we were funding with the Special Needs Resource Agency. At that time, our council decided to build out a children's services department. Previously, we were just an arm of the Ontario Works Department, which really didn't poise us well to manage the contract with the third-party service provider or ensure accountability for the services that we thought we were funding. I moved into the manager position about 8 years ago, and one of my primary tasks was to review the special needs resource services and identify how we could do things better and to ensure that the service provider was accountable for the services that we were funding. Several conversations, a lot of meetings with the service provider really started to point to the fact that they had moved to a very out of scope special needs resource service, one that appeared to be more clinical in nature, that focused more on case management for families who had children with special needs, whether they were in a licensed childcare program or not, and really not meeting the needs of our childcare and earlier system. There were a lot of conversations between myself and the service provider, some of them quite difficult. There was a lot of pushback to the idea that the CMSM had any right to tell them how to operate the services. It really appeared, because we had allowed them to be autonomous for so very long, that they liked that position, and that us holding them accountable now was not a position they were happy being in. I also started to have conversations with a lot of the childcare operators because I couldn't understand why I was sitting in meetings and they were asking for additional services and that there needed to be more funding for enhanced support. And they were claiming that no training was being provided. Again, things that I thought we were contracting the third-party operator to deliver on our behalf. Because of the model that was being provided by the third-party agency, the focus was really on supporting the family and not supporting the staff that were working in the childcare system. And it made me wonder, when we were pursuing some recruitment and retention strategies, trying to ensure that the qualified staff and the staff that were working in our childcare and earlier system stayed there, what this approach to special needs resource may be unintentionally or intentionally doing to the staff that are working in the childcare system. I myself am a registered early childhood educator and can recall quite a long time ago being the educator in a school age room of 15 children and having 4 children with significant special needs, one with Prader-Willi syndrome, a young lady with spina bifida who required catheterization, and a pair of siblings who had muscular dystrophy. And though I had support that came in to do the catheterization, there was no one else coming into the program to support the inclusion of those children in my program. I knew as an educator, that was my job. So I was really starting to wonder how we went from that knowledge that that was my responsibility to somehow thinking that that was somebody else's problem to solve. Because our S&R model had really become very rooted in the we have a special needs child coming into the program, our staff are not competent and capable to figure this out, and that we need supports in place before the child even entered the door. So through many, many conversations, we made the decision that we would discontinue the contract with a service provider and issue a new expression of interest. This came about the time that the Ministry of Education had signaled a review of special needs resource services, so about 4 years ago. And it was important to us that as we move forward with Canada-wide and some of the other initiatives that were being signaled by the Ministry of Education, that we had the right service provider in place. So we were, out of prudence, made sure that we had terminated the contract, but the service provider was welcome to apply. And if for some reason they were the most successful service provider, we felt we were better positioned to enter into a contract that articulated the needs and the services that we wanted and hold them accountable. So we did make the decision to terminate the contract probably very early on in the year, much sooner than we had submitted sent out the expression of interest. As you can imagine, they were not happy, felt that they were delivering a perfect service, that it was meeting the needs of families in the community. And again, how dare we as the CMSM make this decision? We went ahead and terminated anyways. They continued to be the service provider, and the termination date was December 31st of that year. We issued an expression of interest in June of that year. Really spent a lot of time articulating the services that we felt that our system needed, which was going to focus more on building the capacity of staff and not on clinical services to support families who had children with special needs. Our service provider, in addition to moving to more clinical services, had really started to take on the roles and responsibilities and mandates of other ministry-funded programs such as preschool speech and language, children's mental health, and that they became the single service provider, even though their staff wouldn't be qualified nor professionally designated to deliver those services. So we had an impartial team review the expression of interest submissions and determined upon that review that there was no successful applicant. Our council then decided that because we were still required to deliver the services or have special needs resource services available in Leeds and Grenville, that we would bring special needs resource service in-house. which we did in a very quick turnaround. I think we had 6 weeks to move that forward. Our special needs resource service looks a lot different than it did before. We very much focus on building the capacity of staff. We've hired 4 inclusion consultants who are field positions. They do not have offices. They've been outfitted with laptops and cell phones, and their office hours are located within the childcare programs. They were tasked with the very first job at becoming part of the team of the childcare and building up the capacity so that we had educators in our Leeds and Grenville childcare system that were competent and capable regardless of what was coming through the door. As you can imagine, that was a difficult task because we spent a lot of time and continue to spend a lot of time undoing an assumption about special needs resource, that it was somebody else's problem, versus trying to build the understanding or regain the understanding that the educator is the primary person that should be responsible for building the inclusive practice and the inclusive environment for the children. So we have continued to be the service provider for about 2 years now with the 4 inclusion consultants. We're also the direct service provider of the capacity building service, as well as early on child and family center services in Leeds and Grenville. And that team of staff, which would number, I think we're about 13 now, is tasked with working together as one team. One of the biggest concerns when special needs resource came in-house and when we shifted the model was who was going to fill the gap at servicing families, because that was no longer going to be something that we were going to deliver. So we were able to build out kind of that understanding of our team of early on staff, that was their mandate, that was what they were funded for, family support and family education. And so as a collective team, that team refers to one another, provides resources from one another so that our child care system feels like they've got access to all of the services that they need to be successful, and that they know where to direct parents moving forward, because that was no longer going to be part of the mandate of our special needs resource services. We also have built several resources to help our operators navigate things like enhanced support funding, because we realized very quickly that with that default to this is a problem before we've even met the child and that we can't do it by ourselves, that they were jumping to the assumption or the desire for the extra pair of hands and the additional enhanced support funding before the child even entered the program, before there was even an opportunity for the educator to observe the child in the environment, to determine whether or not extra supports were needed. And so we built out a brand new enhanced support process and a triangle triage system where operators have to demonstrate that they are doing everything possible to build a foundation and a philosophy of inclusion in their program before they have access to our enhanced support dollars. Those enhanced support applications are reviewed by our children's services supervisor, and we fund in advance, but with the accountabilities of the operator, that they are going to move forward with those inclusive practices. Things like ensuring their staff are taking training on various children's special needs, or that they're looking at the environment and ensuring that it is an inclusive environment, or that their hiring practices speak to having an inclusive philosophy, that inclusion wasn't the sole responsibility of special needs resource, that it really was rooted in the child care operator's philosophy and practices. And at the end of the day, the Ministry of Education was going to hold the operator accountable for not having an inclusive environment, not the special needs resource service provider. So we've been doing this for about 2.5 years now. We certainly don't have it figured out, but I think we're showing some really great successes. Where operators have embraced this new model of capacity building, we're seeing these beautiful inclusive environments for children, and really working with operators on a continuous basis to shift that thinking of children as competent and capable and staff as competent and capable. Happy to share more information to anyone that might be interested, as well as any of the resources that we have. I hope that's been helpful to you to give you a little bit of insight into the Leeds and Grenville Special Needs Resource Model, and I thank you for your time.
Okay, so one question is collaboration is often essential in this work. Christine and Lynn spoke about that. How do you engage with families, educators, and other stakeholders to create a strong support network for children with disabilities?
I can go ahead. Just the ISP portion of ensuring that parents are having say in what is going on with their child is very important. Being able to ensure that our parents are being supported by the childcare center, as well as the childcare center being supported to help ensure that that parent is involved. looking at different approaches to have that is going to be part of our next 5-year plan. Looking at focus group to really get a better handle on what families in our area are experiencing, and looking at that transition to school and how we can support that. Because that is something we've been hearing from parents, as there is very, very long wait list, 4 to 6 years for speech therapy in our area.
Okay, wow. Anyone else want to, Jen?
Sure. We've been really, I think I spoke about this a bit, but we've been really trying to pull together sort of like community meetings if we're having specific challenges, where as much as possible trying to involve parents as well. So really trying to make it working towards making it sort of more common practice that parents are really helping to drive the care plan for their children, and that they are aware of all of the supports that, we hear a lot. Well, my child's on the wait list for, say, OAP funding, but there's nothing else to do. Well, that's not necessarily true, right? They are holding for that funding, but there's lots of other services that are available in the meantime. And so really trying to pull together the community to figure out, okay, who is all involved, and kind of create those sort of like care teams, right? So.
It means if I could just add, parents are definitely a key stakeholder in this. They know their children first, they know their children best. And often, if a parent is in denial, they'll do the buy-in if you include them in the plan for their child. It's very important to keep them involved.
I agree with Jen. There is that gap. Like I'm just thinking of an example this week with a child who, at 3 years old gets diagnosed with autism. They have an agency that can help them until a diagnosis, but now they are passed on to Autism Ontario, but there's maybe no funding until they go to school. So it's like, where do we work within that gap? So from now until school, kind of making up that plan, right? To make sure that there's still things getting put in place. So yeah, Jen, that's definitely going to be our approach there too.
Oh,
We
Amis, I think
miss
yep, you're on mute, my friend.
Muted, but I remuted. I was just saying, on the heels of that comment, Christine, another comment on what are other gaps that you're seeing in support that you've encountered in the work that you're doing, and how have your organizations worked to fill it? So we've identified some challenges, but what are some gaps in services right now?
Complex medical needs. I'm going to say that.
nursing.
And do you currently support school age programs, and is it the same tier model? Is a question coming in.
Yes, that school age is a big part. We're gearing up for summer now, getting ready to help train summer staff as well.
Okay, everyone else is nodding their head. So what types of assessment tools are you using to reflect on classroom environments?
Sorry, did you want anybody to answer? So I
Yep,
could just,
anyone. I know
okay.
that Shannon was talking to the environment, that the 4 rooms that you assessed. I don't know if that was specifically directed at Shannon, but it's open to everyone.
I'll just quickly speak that we do have our program inclusion tool that we use. So we work with our partners at our ECCDC Center who provide the quality childcare programs for our childcare centers. And with them, in collaboration with them, we have our program inclusion tool, which can help to just kind of make sure that the environment is set up for that inclusion success. And then there are some other tools that can be incorporated, but that is definitely one that we use.
We also use the ASQ, as well as our tool that we created, which also helps really see the things that are needed in the environment to build the skill level. And our tool is really based off of the elect document. It's just a way of for them to click yes, no, so they can really see where the big gaps are for those children, for that room.
So one question I actually have is that through our work with the Ontario Wide Knowing Our Numbers project, we saw that many children with disabilities were being sent home because of workforce shortages, and SNR staff were being pulled into ratio. So for those that have external agencies, how do you prevent SNR consultants from being pulled into ratio? But at the same time, I just came back from a trip to Manitoba, and they are also dealing with the same challenges and considering centralizing staff. And their concern is that when staff is centralized, where an SNR consultant comes from the outside, then children might be isolated or singled out. So this kind of balance between these two models. I just want to see if anyone had any comments around both. How do you prevent SNR staff from being pulled into ratio with agencies, and once centralized, how do you ensure integration of that learning into the classroom and with peers? Well, that's a double-barreled question.
Well, I know for us, that'll be the expectation that they are not to be counted as part of ratio. And they cannot be left alone with children. They're basically, that is the scope, so.
That's the same with our current system. Yeah.
And then is there concern that children, when it's centralized, that children might be isolated or instead of integrated learning? Is there, kind of what kind of plan is there for integration of learning with the child so the child's not singled out? These are some concerns we're hearing from other regions as they're trying to navigate these different models.
That's why we went directly operating, so that we have better control over, that of the narrative, and ensuring that they were, because when it was a third party, it was being segregated. They were doing things on their own. So, and that child wasn't really being included.
I think, Jen, you spoke to that around all these agencies, that the inconsistency of approaches and services when you have various agencies that are responsible for SNR delivery.
Yeah.
Okay.
Yeah.
Are there any other questions? We're almost at the end. Okay, Shannon Brown has said that we are working within a triangle of services that firmly sits on the foundation and responsibility of the operator. The ministry will hold operators accountable for inclusion, not the SNR agency, helping them see and understand their legislative responsibility. Thank you, Shannon. Okay, well, thank you all for joining us today and for being part of this important conversation. We deeply appreciate our speakers for sharing their insights, challenges, and innovative approaches to supporting children with disabilities. Your expertise and dedication is truly inspiring. To our attendees, thank you for your thoughtful engagement and questions. We hope that this discussion has sparked some new ideas and connections that will help strengthen support systems for children and families in your communities. Let's continue this conversation beyond today. Collaboration is key, as we've seen, to creating inclusive and accessible environments for children. Shannon Brown will do a recording, and we will then put it together with this webinar and post it on the, for now, at the Atkinson Center website, hopefully by the end of next week. So thank you again, and we look forward to seeing you in future discussions.